Okay guys, we're talking about how to mash your hip or your TFL actually. So they're not synonymous, but we're going to talk about it as if they are, because a lot of hip pain comes from really tight, either quad, hip flexors, TFL, all this area through here, this tissue gets really tight and contracted. And so if you're getting this recommended to you, it's because you're missing range of motion through here or it's inflamed, something like that. So the tools, the body working tools. So we got two different things here. These are pretty much the two best because this is like a real beginner motion here. It's a a kind of a flattened tennis ball, and then we have the more advanced next spot, which is a lacrosse ball that doesn't really give. A baseball is kind of similar to that. They're both pretty small in terms of their point pressure, so you can get into those spots. The place that we're going for, TFL tensor fascia lata, is you find basically this hip bone out here, the widest part of your body. That's it right there. That's a bone, okay? And then you find basically up about 1 to 2 inches and then forward about 1 to 2 inches. So you're kind of at this angle here. This point in the front, there's a bony point right there, ASIS. That is going to be kind of bisecting both of them. You're kind of going in between there, and it's right in there, okay? So you're going from this bone up about 2 inches and forward about 2 inches, okay? So you're gonna need a little bit of coaching on this. It's gonna take some practice. Remember, when you're mashing stuff, it should feel therapeutic, not invasive, right? So it should be helping tissue, not hurting it. If it feels anything electrical, damaging, you wanna stop immediately, okay? This might be uncomfortable, even painful, but it should be therapeutic, where you're feeling muscle pain, not triggering or enhancing any pain that you already have, okay? So for me, left TFL, and mine gets tight because when I drive or when I sit too long. So what I'm going to do is I'm going to find that position. Again, here we are. Here's the bone. There's that ASIS. I'm going right in the middle. And I'm just going to lay on top of that. Nice and easy. There we go. I can support my head there, and I'm going to just move slightly until I feel that therapeutic discomfort. It's pretty intense, especially, and that's why you want to start with a tennis ball, make sure how intense it is, and you're really just finding intense spots and calming them down. And what that means is you're going to put, kind of like trigger point therapy, you're going to put pressure on it, you're going to hang out there until it takes it basically in half. So if we had a pain scale of like 6 right now, I'm going to hang out here till I'm at about a 3. There I am, I'm at a 3. So now what I'm going to do is I'm going to just move about a 1/2 to a 1/4 inch and find a new spot. So I'm really, even you can be at different angles on the same thing, so you're not even really moving hardly at all. We're talking like a 1/2 inch at the most, inch max, and maybe even less. And then again, it'll climb up, and then you calm it down. Just hang out, breathe. And then you find a new spot once that calms down. There we go, new spot. And then hang until it calms down. Usually you want to find about 2 to 4 spots and just calm them down. You want to do that once to twice a day, just depending on what part of this you're in. And just hang out there until you can't find spots. And that means the tissue is better. So that's mashing your TFL or your hip.